Hello everybody, this is Gary. Today is Sunday, July 10th, 2022. It is 6:20 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today I'm not doing too bad. I was able to do my physical therapy exercises and my exercise bike exercises. I did some work on my computer. Did some errands today, did my laundry, and I'm making this video as part of my daily schedule. Today my paranoia is not too bad, my delusions are not too bad, my auditory hallucinations are at a bare minimum, my depression isn't too severe, my anxiety levels are pretty low. Tomorrow I have an appointment with my peer support specialist. That's somebody that has a mental health diagnosis that works on staff as a counselor at the clinic I go to. This is in addition to the psychiatrist that I see, as well as the psychotherapist that I see. Tomorrow I'll be meeting with my peer support specialist, and we'll be working on setting up goals for me, mostly social goals, to make more friends, to have a wider support network, have a wider assortment of friends and social networks to rely on, because right now my network of friends is pretty small. It's kind of hard sometimes to meet new people, make new friends when you're paranoid and delusional and having auditory hallucinations. My peer support specialist does not have the same diagnosis that I have. I have schizoaffective disorder, which means I could have psychotic episodes and breaks from reality, like hallucinating, delusions, and paranoia. My peer support specialist has obsessive compulsive disorder, OCD, which I do not have. So there is a difference in our diagnoses, and there is a difference in our understanding of our own diagnoses and each other's diagnoses. But we'll have to work past those differences. Tomorrow my appointment is at 2 p.m. I just saw my new psychiatrist on Friday, and we didn't make any changes to my meds because I seem to be stable. I haven't been to the psychiatric emergency room since October 30th of last year, so it's been about 9 months or so since I've been to the psychiatric emergency room, which means I'm stable and there's no need to change any of my medications at this point in time. I'm still on the 600 milligrams of Seroquel, 15 milligrams daily of Zyprexa, 1 milligram of Klonopin split in half twice daily. So it's half a milligram twice daily. And I'm still taking on my other medications for physical pain, namely the Cymbalta, Venerotin, and the Flexeril. I have some pain in my right knee since I had surgery on May 13th, but the pain is dying down as I do more and more walking, more and more physical therapy exercises, more and more exercise bike exercises. Hopefully I'll be able to take my real bike outside sometime soon without putting too much pressure or pain on my right knee. But I'll ask my orthopedist before I start riding my bike. Right now my exercises are basically just walking outside. Today was a pretty nice day out. The weather's been pretty good over the past few days here in Rochester. It's summer, so it gets a little bit warmer. Right now it's about 79 degrees Fahrenheit, and it's sunny outside, so the weather's not all that bad. So going outside is easier this time of year than winter. But other than that, my symptoms seem to be under control, and I'm seeing my psychiatrist again in about a month, and my psychotherapist in about 2.5 weeks. On the 18th, I will be seeing, I believe, a cardiologist. We're just going to go over how my lung and heart health has been going. I did have a stress test and an ultrasound last year, and it showed my heart to be normal. And that's one of the incentives that I had to quit smoking cigarettes, is I didn't want to damage my heart if it already wasn't damaged. I haven't had a cigarette in about 7 months, and I'm still using nicotine lozenges. Other than that, there's nothing else to report on. Like, comment, share, subscribe.